good afternoon, kind of pre-lunch discussion. So Michael Green again. So I'm very pleased to say we have the Honourable Minister Mark Holland, who's going to be speaking to us. And I've seen the Minister make a few remarks over the past few weeks, and you know, he's really is passionate about this topic, and he speaks kind of off the cuff and everything, which is really great. And I know he's got, you know, he's the Member of Parliament for Ajax since 2004. He was the Government House Leader and the Chief Government Whip. And I say he doesn't really look like an enforcer to me, and I know that that's the kind of whip's role, but I think he does it by his persuasive personality. And so he's a great guy. Although he wears a business suit, you can see his personality coming through with his footwear. And so anyway, with that, the Minister has been a great supporter of digital health, and I'm really looking forward to his comments. So without further ado, please join me on the stage.
Well, thank you so much. It's fantastic to be here. C'est un plaisir énorme d'être ici avec vous dans un moment vraiment important pour notre système de santé. Au début, I'd just like to say first how lucky we are. And I heard, Joe, you gave the keynote here today, which is totally appropriate. We have such an extraordinary team at Health Canada. I just want to acknowledge them first and foremost. I get an opportunity to give voice to a lot of what is being done, but we have some of the most exceptional people in the country, some of the most exceptional people I've ever had the opportunity to work with doing incredible work. So I just want to start by thanking Health Canada and Joe and the whole team for all the work that they do. So this is a challenging time in the world. This is a time when I think all of us, you know, coming out of the pandemic and the heaviness and the weight of the pandemic, hoping that that dark time would end with celebration and joy. Instead, we were met with deep, deep challenges in the world, with wars, conflict, with huge challenges that exist within our health system. And so, you know, it was about a year and a half ago when I came into this role, and I think there was a lot of despair, a sense that, you know, maybe our best days as a health system were behind us, maybe that the hope and promise of our health system might not be actualized. And it was and continues to be a very difficult thing to do, to go and talk to people working tirelessly within the health system who are exhausted, to ask them to have hope and to believe that good things are ahead. And I remember at the very beginning of that experience, I think, Jill, you were with me, we were in PEI and we met with a group of nurses, and there was a nurse there who said, look, I can handle anything, but I can't handle the idea that it's going to get any worse. And I think that spirit, that asking just to see things improve is, you know, sat with me and really informed, I think, a lot of our team's work in how do we get that sense of momentum? How do we get that sense of positive direction instilled within our health system? Because one of the, maybe the great, I won't say tragedies, because I think we're going to meet this moment, but one of the great frustrations, I'll say it that way, of our time is that just as the Enlightenment is about to give us its greatest gifts, just at the moment when in so many different fields, some of the most extraordinary things we could have ever dreamed of are on the verge of being made possible, people are losing faith in science and evidence and in the ability of the scientific method and evaluation and data to bring progress to their lives. So I want to talk just at the beginning to say that is what we need to change first and foremost. What is potentially available to us within our health system, and let's talk about that specifically, is nothing short of miraculous. You know, 70% of chronic disease and illness is avoidable. Most of what fills our hospitals and our waiting rooms doesn't need to be there. And the fact that as a society, we're in a circumstance where we have to change is both a crisis and an opportunity. We cannot afford, and we all know this, the cost of a health system that is in its existing circumstance. Waiting for people to get sick, waiting till they're in a state of crisis, and then intervening. We have to transform it. And the good news is that transformation, you can come at it from every angle you want. You know, you can talk about it from a perspective of social justice, you can talk about it from a perspective of cost, and no matter how you spin it, it has to be done. So the question is, how do you connect people to the possibility of transformation? How do you connect people to the idea that having a better health system is possible? And I'll get to a second about how do you get people excited about things like data and interoperability and some of those things that may seem a little less sexy. This is where, and I'll start with the Canadian Dental Care Plan, because you know, people ask me sometimes, why are you spending so much time on a dental care plan when we have a crisis in primary care and we have all of these issues that are existing within our health system? Well, in the first order, dental care, oral health care is primary care. And in the second order, it's exceptionally important while we imagine the transformation that can happen in our health system, that we give people near-term immediate results and demonstrate to them a life made better. And so what does that look like? Well, from a primary health care perspective, to put it in a really bland and direct point, I was just in Newfoundland came back on Saturday. And Dr. Redmond and Gander, just in the first few months of him seeing patients on the Canadian Dental Care Plan, had 3 patients just within his clinical team where they identified oral cancer in those patients. Those are oral cancers that would not have been detected, would not have been identified if it were not for that plan. Now, that's just 3 individuals, but imagine their story if those cancers hadn't have been caught. Imagine the cost, personally, and to the system. And you can go around, I was at a hygienist conference a couple of weeks ago and had the opportunity to talk with hygienists. We have 32,000 hygienists in this country. And this is a group of people deeply passionate about prevention, but frustrated because there's all of these people they haven't been able to get in and see. And the stories that they tell of being able to identify people who are hypertensive, or somebody who has undiagnosed diabetes, or somebody who has some other problem in their mouth that by identifying it now means that they don't wind up with a chronic disease or illness, or they don't wind up in a hospital bed. So getting people excited about dental care and having a conversation about that is fundamentally important because it becomes a lighthouse to what is possible in prevention writ large. Imagine in 6 months, more than 1 million Canadians have gotten care. Those are folks who otherwise wouldn't have been able to afford care. To put it in a really personal term, when we did the 1 million mark and we were in Scarborough, a man came up to me and said, you know, a whole lot of years ago, he didn't identify how many. He said, I had a tooth that was in incredible pain and I went in to see my dentist. And I had it pulled, it cost me over $700, and then I wouldn't go back to a dentist. It didn't matter what was happening in my mouth. I knew I couldn't afford it. How many of those situations existed in our country? I think the next lighthouse that we have to light is in the area of pharmacare. And I see Dr. Eric Hoskins here. I want to thank Eric for your incredible work in starting to lay the foundation and the conversations and work that we're trying to do now in pharmacare. And let me say that one of the things that I think is so powerful of pharmacare, and I think it needs to speak to how we see this writ large before I talk just briefly about pharmacare, is, you know, what was necessitated by that was 2 parties coming together who have a lot of differences, who don't trust each other, and were forced to come to the table and negotiate legislation and try to find a solution for the betterment of the country. You know, so much time, energy, and focus is on what divides us. Imagine what is possible as human beings when we unite in our purpose to a common cause. When what we're evaluated against is not what is the worst thing of our opponent, but what is evaluated in us is our ability to cooperate and collaborate. And I think of that with provinces too. You know, a lot of times you have big differences with provinces. They do things that, you know, I don't like. I don't think that's too shocking. But if I focus on that and say, bad province, you've done this bad thing, I don't like you, province, then what does the population hear? They hear more noise, right? More bickering. They tune out, right? There's so much noise and disagreement in the world, and cooperation is so rare that I would say cooperation is more powerful. So in the genesis of this pharmacare, one of the things that I love about it so much is that it required compromise. It required us thinking about things differently. I would even say that it is better legislation and better conceived specifically because that compromise was forced. And so what we have now is the opportunity in front of us to take on, let's start with diabetes. Diabetes costs this country $30 billion each and every year. That is escalating on a totally unsustainable arc. It's estimated in a few years to be at $37 billion. And what is so deeply depressing is when you go and talk to doctors, they have patients in front of them where those patients can't follow the advice that they've been given. You need to take this medication. You need to take this preventative action. This is how you can manage your disease. And the doctors are like, why am I even meeting with these people? They can't follow the advice they're getting. And then they wind up with a limb amputated or going blind or having some terrible chronic diseaseness or, God forbid, dying. And we all marvel at the madness of it. So making sure that people can get their diabetes medication is fundamentally smart. Not just as a matter of social justice, but as a matter of breaking that curve, of stop having diabetes cost us so much as a society. It's madness that we would do it any other way. So I just came from the Atlantic where I had an opportunity to talk with the three jurisdictions that aren't in an election, because obviously Nova Scotia is in an election, having fantastic conversations about getting that done. The second piece is on contraception. It's imperative that every woman have access to the reproductive technologies that she needs in order to have control over her body. That's fundamentally freedom. It is, to me, wholly unacceptable that somebody, because they don't have enough money, doesn't have control over their own body. You know, an IUD, the failure rate in an IUD is about 0.2%. The failure rate on oral contraception is much higher. It's about close to 10%. So you're effectively saying to somebody who doesn't have money, you lose the ability to decide whether or not you have a family or when you start a family. That makes no sense whatsoever. And what's incredible is in BC, where they've already launched universal contraception, in its first year, it's saving more money than it costs. This is the promise of prevention. So if those two lighthouses can demonstrate and hopefully get people excited about the invisible, because I think about this a lot, how do you get people excited in prevention? In slowly and gradually waking up in an ever healthier and more productive society. Then what is next must be data and interoperability. Folks, we've talked about this for 15 or more years. The promise of what an interconnected health system could mean. I don't need to talk a lot on this point because I know everybody here has been brought in and listened to presentations much stronger than mine on both its potential and opportunity. I am here to say that I am amazed as I go around and I talk to Canadians. I thought there would be a lot more resistance around issues of privacy or issues of how, but people are so frustrated and understand that the system in its actual state isn't working, that they're actually willing to trust that we can get the data governance right. They want to see us move forward on these solutions. And I've been heavily encouraged in my conversations going back to Charlottetown when we signed a digital charter, and every conversation since, that every conversation I have with health ministers of every political persuasion, that there's a great openness to this. And we need to drive it now. The incredible opportunities that new technologies and AI present to us are only going to be actualized in an interconnected data system. We've already laid really important foundation, not only in the digital charter, but in the bilateral agreements that we've signed with every province and every territory. Having for the first time common indicators, but also building into those plans access for patients to have access to their own digital patient record, and to be able to provide support for the necessary infrastructure that is going to be required for us to do this. But I want to say for Infoway, and I understand for those here in the room, there are incredibly powerful things that we can and must do to rapidly accelerate this adoption. And I'm excited to talk about those things, I hope, in the very, very near future. But we are very attuned to them. Because having a health system of the future starts with having data. Imagine for the first time, not against nearly enough indicators, but for the first time in this nation's history, CIHI released baseline data for every province, every territory. That's huge. It's not nearly enough, but it's a base from where we can start. Now, instead of anecdote driving what we're doing, we can start to be driven by data. So I could talk about as well the connected care legislation. If any of you get an opportunity to talk to a member of parliament, that's a fun social opportunity for you. But aside from being a fun social opportunity, please mention Bill C-72. This connected care legislation is so important to the agenda that we need to achieve, and I'm aware of no partisan opposition to it. I've heard no political party speak in opposition to it. Then surely this is something that we can pass as a House. There's lots of things for us to cross swords over, but I don't think this is one of them. And maybe I will, there's so much more to say here, but maybe I'll end on this note. We talk a lot about what isn't working in Canada, and that's fair. But there's a lot of things that are, that we need to build on, not tear down. And I'll talk about health span as one of them. I think health span would be familiar to everybody in this room, but it's something that I think a lot about because while I lost my father at 78, and we weren't close in any way, I watched my mother, who's 80, still working 25 hours a week as a psychotherapist, traveling the world and enjoying some of her best years of her life. She was just at a Buffalo Bill game on the weekend. And tailgating, if you can imagine. And I want that for everybody. We need to think about the last 10 years of our life and imagine them in joy and happiness with family, doing the things that we dream of doing when we think of our retirement. Canada has the opportunity to be the best country in the world in which to age. You talk about moonshot, you want to talk about a dream. We need to move above the problems of today to imagine what we can have. Interoperability is a huge piece of that. And we can remember that we already have a huge advantage, a lead in that journey to achieve that goal. How often do any of us take a moment to recognize that health span, the number of years that we live in health and not illness in Canada, is 1 year better than Italy and France. It is 2 years better than the United Kingdom. It is 6 years better than the United States. For sure, without question, we need to be evaluated on our productivity and our GDP. But for goodness sakes, we absolutely need to be evaluated on our health and health span. I can think of few things more important than how many years we get to live in health and happiness. That is 100% in our control. It requires the coordinated vision of all of you in this room and for political leaders everywhere to be focused on one thing. Because imagine, during the pandemic, for a rare, brief moment, the entirety of the health system moved in one direction. And in doing so, we achieved remarkable things. We have to have that be the spirit that lives within us. Radical cooperation, working together everywhere, where anybody who seeks leadership in health is evaluated against their ability to do that. I thank you so much for the work that you're doing. It's such an honor to be able to say hello to you here today and to share what I think is a really exciting story about what we can achieve together for our health system. Thank you.